Like she said, my name is Erin. My fiance has multiple sclerosis. He was diagnosed in May of 2019, so pretty recent. Um, he was 27 at the time, and he had initially just kind of felt a little bit off, where he thought that his like hand was tingling or his legs would get this like buzzy, stabby sensation that felt kind of electric. He grew up playing like lacrosse and skateboarding and things like that that could cause all sorts of neck and body issues. So at first, with him being as young as he was, we kind of assumed that he had like maybe a herniated disc or something from all of his like harder action things that he did when he was younger. But as it didn't go away, he decided to go see his doctor, who referred him to a neurologist. We were exceptionally fortunate, especially with multiple sclerosis, which some of you may not know about, but it's a demyelinating disease. So it means that the nerves that process sensory information, over time, the body attacks those nerves and gets rid of the coating in it that's called myelin. What that does is it prevents the neurological impulse from going smoothly, which means it can get miscommunicated. You can get spasticity of your muscles, which is where they kind of twitch. You can get loss of sensation. You can get inappropriate sensation. You can get loss of control entirely. There's a pretty broad spectrum of things that can happen with multiple sclerosis, depending on where in your body the lesions happen. So that's one of the things that makes it a little bit more difficult to pin down as well. But he presented to his doctor, said, hey, I've been having this like tingling in my hand mostly, but every now and then it's kind of in my legs. I'm not really sure what's going on. He was very fortunate to get referred to a neurologist early, and he got referred to a neurologist who thankfully was very well versed in multiple sclerosis. Interestingly enough, this neurologist was actually retiring within a month of him being referred to him, and for some reason decided to take him on as a patient anyway. Got him scanned from basically head to, I guess, waist, since multiple sclerosis is primarily within the spinal cord and the brain. And within a month, thankfully, he had his diagnosis. He had one specific lesion in his cervical spine, which is what was causing the vast majority of his symptoms, as well as a smattering of lesions within his brain. Now, the treatment for multiple sclerosis is largely immune therapy to suppress the immune system, because largely it stems from your body's cells that usually fight off infection being sensitized for one reason or another to the cells in your neurological system. And so largely the only way to prevent progression or to stem off active lesions is to suppress your immune system. So it was last November that he first got a treatment. In men, the progression of multiple sclerosis, especially if you are diagnosed young, can be very quick. There's a couple different kinds of multiple sclerosis. I won't go too in depth into those, but largely in men, progression tends to be a little bit faster, and disability tends to accrue more significantly and faster. So his initial doctor wanted to be pretty aggressive early on to try to stem off any accruing of disability by really hitting him hard with an infusion therapy right off the bat, and then maybe stem down to a little bit lower maintenance after the fact. So he got an infusion therapy last November. It's a drug called Lemtrada. It was initially developed for chemotherapy. The way that it works is it completely eliminates the immune system that you would do for like a leukemia or something where the body is inappropriately creating immune cells. So in November, you're supposed to get 5 treatments, 5 days in a row. And then the year after, you get 2 to 3 treatments. And then after that, for the most part, 70% of people are in relative remission for MS, which is largely unheard of with other treatments. Usually it's consistent monthly, bi-monthly, every 6 months or daily treatments. So we were pretty excited to try it. We thought it would be his best option without a doubt. He got through the first 2 days, certainly didn't feel well, because just like chemo, it's tough on your body to go through those infusions day after day. Day 3, he went back in to get his 3rd treatment, and he kind of offhandedly mentioned like, oh, I've been kind of coughing this morning. I think maybe at some point I coughed up a little bit of blood. I'm not sure. Which naturally the nurses at the infusion center were like, oh, no, 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 we are not going to infuse you today. Like, you need to go to the hospital. Please go get this checked out. At that time, he went to the emergency department. They did scans of his lungs and ran labs and whatnot, and they found that his lungs looked basically just completely filled with fluid. And so there have been a couple of case studies with this treatment itself that have shown that people can get something called flash pulmonary edema or alveolar hemorrhage. So within your lungs, the very farthest part down the branch are these little air-filled sacs called alveoli. They're what let your body exchange oxygen and carbon dioxide so that you're able to actually utilize the air that you breathe. And in certain illnesses or reactions, you can have fluid or blood fill those sacs. And when that happens, you're no longer able to exchange air appropriately. And it becomes much more difficult to breathe, and it can be pretty dangerous. Many, many different things can cause it, but certainly reactions to things like medications are not low on the list. So they admitted him to the hospital for a few days. He was not able to complete his course of the Lemtrada treatment. Thankfully, he recovered fairly quickly with steroids, which again suppressed his immune system so that it didn't attack his lungs and cause them to fill up with more fluid. And he was able to go home a few days later. That kind of left us with this uncertainty as to whether or not the treatment was even effective, because he'd only received 2 of the 5 days. And even if he'd gotten all 5, he still in theory needed another full year of treatment to even see the 70% chance of improvement. So we just kind of played the waiting game for a while. He got labs every month. He was on antibiotics, antivirals, antifungals, all sorts of medications to prevent him from getting an infection because they had effectively deleted his immune system at that time. And then Lemtrada itself, the treatment, always runs the risk of, as your immune system reconstitutes itself and builds itself back up, there's always a chance that you can get what's called like a secondary autoimmune condition, which is when the same way that initially he presented with multiple sclerosis, which is an autoimmune disorder where the immune system attacks itself. As it reconstitutes itself, you can get a different kind of autoimmune condition on top of the one that you already have, because you're building off of a theoretically already faulty immune system. So one of the things that they do to prevent that is they monitor 2 different immune cells in your body, your B and T cells, and make sure that they come back at equal levels. In February, they saw that his levels were a little bit off, so they gave him another immunosuppressant medication called Rituximab to lower those levels back down. As we all know, in March, COVID started. So he had effectively had his immune system re-deleted in February, and then March started, and he was now, again, immunosuppressed more so than he already was. We are very lucky in that he was able to work remotely for his job. So he wasn't having to go in and be in danger. But we still knew that his doctor's appointments are now going to be largely remote, which with neurologic illness, it's fairly difficult to really keep a good track on how people's symptoms are or are not progressing remotely. There's a lot of physical exam things that go into monitoring mental or physical illness. And it also took a toll on mental health, knowing that like he couldn't see anyone from work. He largely couldn't see me once I started work. And that it was a little bit harder for people to keep track of how his symptoms were progressing. I moved back to Houston in June. And so since then, we've been largely separated because I work in the emergency department with COVID patients as well. He was getting monthly labs to make sure that he wasn't getting infections of his urine or other things to see how his immune system was reconstituting and everything like that. And then about 2 or 3 months ago, he started having worsening like GI gastro upset where he was pretty nauseous all the time. He had some issues going to the bathroom. Things were just not very smooth for him. And they ran a couple more thyroid labs, and it turns out that he was fortunate enough to develop a secondary autoimmune condition. So he had developed something called Graves' disease, which is a form of hyperthyroidism. Your thyroid kind of controls everything in your body's metabolism. So it controls how quickly your body uses up fuel. It controls your heart rate. It controls your metabolism. It controls the rate at which things go from your mouth out into the toilet, everything from start to finish. So he was losing some weight. He was having trouble eating. His heart rate was sometimes up to like 130 to 150. For reference, normal is like 60 to 80. So he was having this really rapid heart rate. He had trouble breathing. At baseline, he had asthma regardless. So it kind of just all built on itself and made it a little bit more difficult for him to function. But at this time, all of his doctor's visits were across Zoom. So he was able to tell his doctors, yeah, my heart rate's been pretty high. I haven't been feeling very well, but it's pretty hard to relate across a screen how badly you're feeling and how unwell you really are. The first time he saw another doctor in person was in September. He saw his neurologist. They talked over his new symptoms. At that time, he was about 170, 175 pounds. Pretty normal. He's about 5'11". It was a normal weight for him. They talked through his symptoms. They talked through different treatment options. They said that they wanted him to see an endocrinologist, which is a hormone doctor, to talk about his new Graves' disease diagnosis, figure out what the treatment would be for that moving forward, and kind of whittle away at the issues that they knew existed and see where they could go from there. So he saw his neurologist in September. He had a Zoom meeting with his endocrinologist shortly after. They decided that they were going to start him on a type of medication called a beta blocker that not only lowers his heart rate for symptomatic relief of his Graves' disease, but also helps decrease the total amount of thyroid hormone, which increases your metabolism, increases everything in your body, throughout the body. So he started on that, but he still kept having like some stomach upset, some issues eating, and just really wasn't feeling very well. He kept trying to touch base with his doctors about having cramping pain and not really being able to eat very much. And his doctors were trying to figure out what it was and just thought like, oh, you just need to eat like a more bland diet, maybe take some Imodium, something to try to like help symptomatically, because it was probably due to his Graves. Well, fast forward to about a week and a half ago, he was no longer able to eat. I was in Houston, so I was not there able to help him. He was profusely sick. He couldn't hold down food. He was unable to get off his couch by Monday because he'd been sick so many times in a day and overnight that he wasn't able to keep down water. He couldn't get up. His mom was in the parking lot to come check on him, and he couldn't get to the door to let her in. So this past week, he was admitted to the hospital. They found him to have colitis. At this time, he was about 130 pounds. He was 170 in September. And so he was put on IV fluids, IV antibiotics. They thought that he had an infectious colitis potentially, which is inflammation of your large intestine. And they kind of didn't really know what else to do. They gave him things to keep him from throwing up through his IV. But even with all those medications, he was still not able to tolerate anything by mouth. He ended up getting a scope called an EGD, which is through the mouth, that showed significant inflammation of his esophagus. It was too inflamed for them to take biopsies, but it was severely ulcerated. His stomach was ulcerated and his small intestine was ulcerated. Thankfully, within the past week, they were able to get most of that under control to the point that he is now home, which is why I am now in Austin with a mask, to try to help him kind of get back on his feet now that he's at home. He's doing much, much better and is able to eat and drink, which is really the important thing. But I think all of this were certainly complications that we didn't expect going into treatment. I don't think anyone could have predicted COVID in general, but certainly having gotten 2 rounds of immunosuppressants prior to even the beginning of COVID, there was a lot of uncertainty for us going into this time period. one of the things that I think we have learned most from it is kind of how to be creative and how to support each other. Because the same way that Alex was talking about, like, no one's pain is isolated. Just because someone else may have a greater source of pain doesn't mean that the other person doesn't also have pain. So we've both kind of struggled through this transition period. Certainly me being at a distance, not being able to help, and him being the one that's actually physically suffering. But we got creative. On weekends, when I had Saturdays off, we would meet halfway at a dog park with masks on. So we were outside, and it was largely safer. He had 2 of our dogs, I have 1. And then we would have a car date at a local fast food place, usually Dairy Queen because we're from Texas. But we would each go and get our food and then pull into adjacent parking spaces and just talk on Bluetooth through the windows as if we were sitting down together, but not really. And we just kind of got more creative about how we spent our time together and more intentional about spending time together, because we knew that both of us still needed it for the support of either person. We started occasional dates where we surprise each other with a different Grubhub meal to their apartment. So we've done long distance before, but this was a little bit more intense. We weren't actually able to visit each other. So we would pick a night and we would choose a show to watch, and we would say, all right, we're going to do it at about 7:30. And then we would surprise the other person with some Grubhub meal, and they would just have to open their door and figure out what it was. And so I think that if anything, it's just made us a little bit more intentional about the time that we do get to spend together. We had a conversation earlier today that, like, as silly as it is, we were kind of thankful that he ended up being in a hospital because he got face-to-face care from physicians. He got real-time updated numbers on his actual immune system. We now know that he's about 80% of normal, which is better than we expected. He mounted an immune response against an infection, which was better than we expected, which is why I'm thankful enough to be physically in a building with him again, with a mask at all times. I go outside if I take anything to drink. We share our meals outside on a picnic bench. But I think it's made us a little bit more thankful about the time that we are able to spend together, and just be really intentional about making sure that every day we talk on the phone, we share what we can with the other person, and that we really check in on how the other person is doing. Because although he is the one who is more medically fragile, I think that emotionally we're both kind of on the same page, and it's good for us to both be sure that we check in with the other. So although that wasn't as eloquent as Alex's, that's just kind of how we have gotten through our experience over the past couple of years. COVID was a very strange experience for everyone I know, and it still will continue to be. Hopefully we're able to curb it a little bit better in the next few months and not let it keep spiraling out of control, but we'll kind of have to just wait and see and continue to do the best that we can to be with the people that we love, who are maybe at a little bit higher risk than others.